A study claims that eating just half an egg a day may increase your risk of dying from heart disease. That sounds hard to believe, doesn't it? Especially since you, like millions of others, have been eating eggs for decades. So why would a study come to such an alarming conclusion? Are eggs really a silent killer? Or have we misunderstood cholesterol, the research data, and what heart-healthy nutrition truly means? In this video, I'll break down exactly what the study says, what's questionable about it, and why what you believe about eggs may have been shaped by misleading information. If you're over 50 and trying to eat healthy, this is something you can't afford to ignore. A recent study published in a reputable medical journal has caused widespread concern. The headline was striking: "Egg consumption linked to higher risk of death from cardiovascular disease and other causes." The study analyzed data from over 30,000 adults who were followed for nearly 3 decades. During this time, researchers used food questionnaires to collect information about participants' diets, including their average egg intake. The results showed that people who consumed about half an egg per day had a higher risk of dying from heart disease compared to those who ate fewer or no eggs. The study's authors attributed this mainly to the cholesterol content in egg yolks, which has long been blamed for increasing the risk of atherosclerosis and heart attacks. On the surface, the data seemed to reinforce the old belief that cholesterol in eggs is harmful to heart health. However, before jumping to any conclusions, we need to take a closer look. What kind of study was this? Were the methods of data collection reliable? And most importantly, does the link between egg consumption and mortality actually prove causation? The answer lies in the nature of observational studies and the confounding factors that were not fully controlled. The type of study used in this case was observational, meaning researchers tracked participants' behaviors and health outcomes over a long period of time without intervening directly. They relied on self-reported questionnaires in which people recorded their dietary habits, including how often they consumed eggs. This is the first major limitation to highlight. Food frequency questionnaires depend on memory, which can be inaccurate, and are often completed only once or at infrequent intervals over many years. This raises serious concerns about the reliability of the input data, especially in a study spanning multiple decades. Additionally, the participants who ate eggs more frequently in this study also tended to consume more red meat, fried foods, refined carbohydrates, and were more likely to smoke. These behaviors are all well-established risk factors for cardiovascular disease. Although the researchers attempted to adjust for these variables, it's virtually impossible to eliminate their influence entirely. This is a common issue in epidemiology known as confounding. In other words, we can't be certain whether eggs themselves were the cause or whether egg consumption simply reflected a generally less healthy lifestyle. Another important limitation is that the study didn't account for the quality of the eggs consumed. There is a significant difference between pasture-raised eggs high in omega-3s and conventional eggs from caged hens fed processed feed. Cooking methods also matter. Boiled eggs eaten with vegetables are not the same as eggs fried in refined seed oils alongside sausage and white bread. These details were not clearly distinguished in the study, making it unfair and scientifically inaccurate to blame a single food item without context. For this reason, any conclusion that egg consumption increases mortality risk must be considered in a much broader context. We need to ask, what else were these people eating? What was their lifestyle like? Did they exercise, manage stress, and get adequate sleep? Without this information, the link between eggs and heart disease is just one small part of a much larger picture. Eggs are among the most nutrient-dense foods humans can consume. A single egg contains all essential amino acids, B vitamins, vitamin D, iron, zinc, and especially choline, a critical nutrient for liver function, brain health, and the nervous system. Choline plays a key role in building cell membranes and is the precursor to acetylcholine, a neurotransmitter essential for memory and focus. This is especially important for people over 50 when cognitive function often begins to decline. The yolk is where most of the egg's fat and cholesterol are found. One large egg contains about 186 milligrams of cholesterol, nearly all of it in the yolk. In the past, dietary cholesterol was thought to be a major factor in raising blood cholesterol levels, and therefore increasing the risk of atherosclerosis. However, more recent research shows that dietary cholesterol has little effect on blood cholesterol levels for most people. The body has a built-in regulation system. When dietary cholesterol increases, the liver compensates by producing less cholesterol internally. Moreover, cholesterol is essential for hormone production, cell membrane structure, and vitamin D synthesis. Trying to completely eliminate cholesterol from the diet is neither realistic nor advisable, especially for older adults who need to maintain tissue repair and proper hormone function. What matters more is the type of cholesterol in the blood. Small, dense LDL particles are more strongly associated with cardiovascular risk than large, fluffy LDL particles. HDL, often referred to as good cholesterol, helps remove excess cholesterol by transporting it back to the liver. Studies show that egg consumption can raise HDL levels in many individuals and generally does not significantly increase harmful LDL. This suggests that eggs have a neutral or even beneficial effect on blood lipid profiles for the majority of people. Taken in full context, eggs are a highly nutritious food that can be a healthy part of the diet for older adults when consumed in moderation and paired with an overall healthy lifestyle. Blaming eggs for heart disease without considering the broader picture oversimplifies the science and does not reflect our current understanding of physiology and nutrition. If eggs were truly a direct cause of early death, as some observational studies suggest, we would expect to see clear evidence of that in communities where eggs have been a daily staple for generations. But the reality shows the opposite. Many older adults in rural areas, from the United States to Europe and Asia, have eaten eggs regularly since childhood and continue to live healthy lives well into their 80s, 90s, or even past 100. They often consume boiled eggs, fried eggs, or omelets prepared with traditional fats like pork lard or olive oil. They also stay physically active, eat mostly whole foods, get adequate sleep, and live with relatively low stress. These lifestyle factors play a much more significant role than how many eggs they eat per week. In clinical practice, many doctors and nutritionists have observed that individuals who include eggs as part of a healthy diet often have favorable lipid profiles, maintain stable weight, and show lower cardiovascular risk compared to those who follow diets high in refined carbohydrates. This is supported by data from long-living populations like those in Okinawa, Japan, Sardinia, Italy, and Mediterranean regions. These communities do not avoid eggs. Instead, they consume them as part of a balanced diet that aligns with their traditional way of life. In the comments sections of videos and articles about nutrition, we also see a common skepticism toward anti-egg research. Many people cite their own experiences or family history, where grandparents ate eggs daily, did physically demanding work, and lived healthy for decades. While anecdotal stories can't replace scientific data, repeating real-world patterns that contradict statistical associations should at least prompt a closer look, especially when those associations are based on self-reported food frequency questionnaires and statistical modeling. Looking at reality isn't about rejecting science, but about putting data in proper context. Eggs are not isolated from the rest of a person's diet. Eating eggs alongside vegetables, healthy fats, regular physical activity, and good sleep hygiene produces a very different outcome than pairing eggs with white bread, processed meats, and sugary drinks every day. When assessing the risk of heart disease, the key isn't to isolate a single food like eggs, it's to consider the bigger picture, your overall diet, lifestyle habits, and individual physiology. Over the past 2 decades, medical research has consistently shown that the real drivers of cardiovascular disease are not tied to one isolated factor, but are the result of a combination of metabolic risk factors. These include insulin resistance, chronic inflammation, high triglycerides, low HDL, high blood pressure, prolonged stress, physical inactivity, and poor sleep quality.
Someone who eats eggs daily but follows a low-sugar, high-fiber diet, exercises regularly, and maintains a healthy weight is at much lower risk than someone who eats fewer eggs but smokes, drinks frequently, avoids exercise, and consumes a diet high in ultra-processed foods. This is why modern medical guidelines are moving away from targeting specific foods and instead adopting a more comprehensive approach based on dietary patterns and lifestyle behaviors. One commonly overlooked factor in the cholesterol debate is the makeup of LDL particles. LDL is not inherently dangerous in all forms. Small, dense LDL particles are more likely to penetrate arterial walls and oxidize, contributing to plaque buildup. In contrast, larger, buoyant LDL particles are generally less harmful. Eggs may slightly raise total LDL in some individuals, but they also tend to increase LDL particle size and boost HDL, improving the HDL to triglyceride ratio, a strong indicator of cardiovascular health.
That's why the focus shouldn't be on cutting eggs from your diet, but rather on how eggs are incorporated and what they're paired with. Eating eggs alongside leafy greens and healthy fats creates a very different metabolic response than eating them with white bread and sugary drinks. And choosing high-quality eggs, such as organic or pasture-raised, can reduce exposure to unwanted antibiotics, hormones, or industrial feed fats that may be present in factory-farmed eggs. The warning here isn't that you should avoid eggs at all costs. It's that you should step back and assess your full health picture. If you're at high risk for heart disease, don't rush to blame the eggs. Take a closer look at your sugar intake, activity level, stress management, and sleep quality. Eggs are just one small piece of the puzzle and not the root cause if your overall lifestyle is out of balance. The conclusion that eating eggs increases the risk of death from heart disease is an oversimplification of a far more complex issue. When a study relies on self-reported questionnaires and cannot fully eliminate confounding factors, the association it finds isn't strong enough to justify strict dietary recommendations for the general public, especially when there is substantial evidence that eggs within a healthy dietary pattern are not harmful and may even offer health benefits. For older adults, eggs provide high-quality protein and choline, essential for proper nervous system function. Eliminating eggs from your diet without a clear reason could mean missing out on a valuable source of nutrition, especially during a stage of life when preserving muscle mass, cognitive function, and heart health becomes more important. That said, this doesn't mean you should eat eggs indiscriminately. Pay attention to the source, how they're prepared, and how often you consume them. If you have a history of heart disease, high cholesterol, or metabolic concerns, consider more specific tests like advanced lipid panels, HDL to triglyceride ratio, and inflammation markers to assess your actual risk. Based on these results, you and your doctor can determine a diet that fits your personal health profile, rather than following broad one-size-fits-all advice. Eggs shouldn't be judged in isolation. They need to be evaluated within the context of your full lifestyle, individual biology, and health behaviors. Ask better questions, dig deeper into the data, and don't let shock headlines mislead you. Long-term health doesn't come from avoiding a single food. It comes from how you live every day. If you choose whole foods, manage blood sugar, stay physically active, and get quality sleep, an egg a day can absolutely be a heart-friendly part of your life. If you found this video helpful, subscribe to the channel so you don't miss future evidence-based breakdowns on nutrition and heart health. This is where you'll find honest, clear explanations in a world full of noisy headlines. See you in the next video.